P10 UKI is a patient support group that is in the UK and Ireland. We are run by patients and parents of children that have been diagnosed with P10 hamartoma tumour syndrome. We've put on today it's really important, we're a rare community and we want to come together as a community, share our stories, our diagnostic journeys. We want to speak to all the medical professionals and the researchers that are passionate about our rare disease, and really together information is key, and we can hopefully come together and build better services, more awareness and understanding of the disease and the condition, and hopefully drive information forward for the future.
Well, I think today is quite a special day really, because obviously it's the first time that we've had a face-to-face patient meeting since COVID, and actually I think certainly from P10 researchers' perspective, quite a lot has moved on and developed. We've actually, particularly in our sort of research portfolio, moved forward. And so actually to be able to bring and share a summary of that information and get the reaction of patients has been really critical. Quite apart from just again having the opportunity to meet with the patient community face to face, as well as other researchers and experts in the field and so on. It's been an absolutely fantastic day.
Every clinician will have come across these rare diseases, are an exemplar where we often face our first patient. And often patients learn a lot. They are experts by experience.
Initially, I don't think I understood my diagnosis at all. I went away quite happy. It was, I would say, about 6 months later, once I'd started having all of my testing, that I realised that it was very hard to constantly have to be checked for cancer and wait for results. Very difficult.
My son doesn't know he has a diagnosis, so that for me, a child being diagnosed with a rare disease, unfortunately it's from my perspective and how I felt with the diagnosis, because my son has got a very low IQ, so he isn't aware, he's just happy in his own world.
For us it was quite devastating, because at the time the only information we had was online. It was maybe about 7 or 8 years ago, and everything you read was doom and gloom. However, obviously because of the P10 meetups and things, we now know that that's not the whole truth.
I think the patients already know that most health professionals don't know much about PHTS, and I think certainly when they're talking to their GPs, they should be aware that it's unreasonable for their GPs to know anything about their condition, but their GPs should be willing to learn about it. So it should be a partnership. I mean, many specialities that will just not be familiar with this condition at all, and I think that's not unreasonable because it's a rare condition, but the health professional should be willing to learn from the patient.
It's the experience of the patients that I can learn specifically. Nobody else can make this experience. And I am a specialist, for instance, on some aspects of the biochemistry of the immune system, and I don't expect the patients to have these steps. But if we learn from each other, then we can meet and really have a joint journey, supporting patients with rare diseases.
How important is it for the health professionals to understand the patient's perspective? Well, I think it's very important.
I think it's absolutely critical for any healthcare professional, whether they're a physician or a researcher, to really understand what patients want and need. What might seem to be the priority on paper and what is actually the need and priority in reality can be two completely different things.
Most doctors won't have heard of it, most doctors won't know what it is, and patients will probably know more about their condition than the doctors do.
We need to understand what the problems is, and even so, more so in rare diseases where there are exceptional presentations, exceptional problems of the patients, and we need to know what the patient quality of care, how to improve quality of care, and to listen to patients' concerns.
But there's going to be different levels of understanding, different levels of knowledge. We're coming about it from different perspectives, like is it the child, is it a teenager? It's the medical professional coming about it from a sympathetic point point of view and understanding where their patient is at and making it a more personable service.
So important, the most important thing that they can do, quite frankly, I would say, even above understanding what you've got.
We exist purely to support and to serve the patient community, so I don't think I can think of anything more important.
So my dream as a parent of someone with P10, but also as the charity manager, is to set up these clinics in the UK where you can come and see specialists.
A clinic in one place where you could go for the day would just be amazing. It would be like one person would then know the patient and everything that's wrong with them or not wrong with them.
Would benefit the patients and the health professionals, because there'd be one place, one contact place where all the questions that people are struggling with could get answered. We would learn from each other, we'd learn from the patients.
For me to come once a year, get that all done and then go away again and knowing you're in safe hands, that for me is the dream.
It would be invaluable to some patients, I think.
I cannot wait for something like that to exist, because currently I spend half my life going between 4 hospitals, trying to get my appointments booked. I book them all myself. It takes so much of my time and it is so stressful. The thought of arriving and having 1 to 2 days to do everything, I would travel anywhere to have that done, to have somebody who understands what they're doing. The stress would go. It would be wonderful. It's the ultimate wish for me.
Sometimes the research is complicated, it is time consuming, and actually as researchers we have to work within a number of different legal and ethical constraints, and that requires patience and time, but also support and partnership from people with PHTX and their families.
What I'd like people to take away from today is, well, first of all, we are a community, and although we're rare and although we are, I get very emotional, so sorry. Although we are spread about the country, we are all here to support each other.
Participating at a patient event like today sort of gives me an additional perspective to what I see typically in clinical practice, because we have half an hour, sometimes we have a bit more, but time is limited and we're typically focused on a specific medical problem. And a day like today allows me to see families. It allows to see some of the young patients that I would see in practice in an environment with their families, and that sort of is very important.
The things I've learned from speaking to patients today, actually it's been quite a humbling experience, because I've realised that there is still a lot of things that we need to be doing better. Many of the patients are struggling with getting the right care, and I'm quite frustrated. And I know there have been some issues, such as COVID, which have made life difficult, but I think we can definitely do a lot better.
There are a lot more people in the same boat as me today. I've learned I'm not by myself, which to me is the most important. It feels very lonely a lot of the time, and it's not the case, which is great.
So although P10 can affect you in different ways, you will always find somebody here that's going through something similar.